Breast cancer as an inheritable condition. What you and your family must know. If you are very young when you contract breast cancer, it is important to have some research done into the heredity of your condition. Your doctor will discuss this with you and refer you to a genetic consultant. If you have many cases of breast cancer in your family, you can, in consultation with your doctor, get in touch with a policlinic for clinical genetics. Why? Sometimes breast cancer is hereditary. There is a fault, a genetic mutation in your DNA. A gene is a piece of hereditary material which contains the predisposition for a certain characteristic. There are two of these genes known to be the hereditary predisposition for breast cancer: BRCA1 and BRCA2. If there is a fault in the BRCA1 or 2 gene, there is a 60 to 80% chance that you will contract breast cancer. In addition, there is an increased chance of contracting ovarian cancer. Therefore, you are a carrier of a fault in the breast cancer gene and can pass this fault on to your children, sons as well as daughters. If a patient is found to be a carrier of a faulty BRCA1 or 2 gene, it is easy to confirm which family members are also carriers. These family members are then warned and are able to weigh up for themselves the decision to have their breasts or ovaries removed as a precautionary measure. Another, less drastic option is to have regular checkups from the age of 25. What does genetic testing consist of? Genetic testing consists of family research and DNA research. In family research, an investigation is done into which members may have had breast or other forms of cancer. This information determines whether there is enough reason to do DNA research. DNA research is done first in someone known to have cancer. If this is the first time the research is done for a family, the results are usually available within 2 months. Hereditary defect. Carrier of the BRCA1 or 2 gene. What has to be done if you are clearly found to have the hereditary defect? In this case, you become eligible for periodical checkups for breast cancer, but you could also consider having your breast preventatively removed. Not an easy choice. In addition to this, the advice for women from the age of 35 or 40 is to have their ovaries removed. It is possible to have your egg cells removed and preserved before the operation so that you might get pregnant with the help of IVF. If it is suspected that you have the gene for breast cancer, you will visit the gynecologist once a year. This specialist checks your womb and ovaries every year with an internal echography, or echo. Counseling. It is important to consider the consequences of hereditary defect before you choose to have genetic research done. Do you want to know? Once you know, there will be difficult decisions to be made. Often counseling is advised. Make use of it.